Hi, my name's Jan, and I moved to La Quinta in June, and I had a lot of continuous pain, persistent pain, that I would categorize now as chronic. I had it for about 7 or 8 months, and I was seeing a different type of chiropractor, and I can now say that through my visits with Dr. Rodriguez, that not only is my muscular pain gone, but most of my joint pain and the chronic pain that occurred every time I did long-term tasks, daily routines, just daily living started to deteriorate. And I can honestly say that after visiting Dr. Rodriguez for approximately 3 weeks, and I am now able to do all of my activities and probably some of the heavier activities I shouldn't be doing without pain. I'm moving freely. I am moving with a type of air about myself that I feel good, I feel confident, and I'm grateful, very grateful that I came to Dr. Rodriguez.
I'm John Frazier from the island of Kauai in Hawaii, and I began seeing Dr. Rodriguez probably about 1.5 years ago. And I originally went for probably a back problem or some other physical bone adjustment that I needed. But over time, I discovered that Dr. Rodriguez had the skills to address almost any kind of physical issue that you had. And I kept on seeing him for almost the entire year he was on Hawaii and on Kauai, but I came back quite a few times for anything that came up, and I have a serious problem with vertigo, or I did, and I kept coming back to Dr. Rodriguez, and he kept working on it, and I think right now I am pretty much free of vertigo, which is a fairly difficult problem to solve. And what I appreciate about Dr. Rodriguez is that he probably understands the anatomy of the physical body almost better than any doctor I've ever come across. And I do healing work on my own, and I've been involved in studying the anatomy of the human body myself. And I've just been amazed, for instance, my inner ears, about how much knowledge he has about all the detail about what's in the inner ear, and he'll go in and he'll look at each individual piece of the inner ear and check that and dig and dig and dig and finally come down to an underlying issue, which is typically emotional, and he uses a neural emotional technique to clear these issues along with muscle testing, kinesiology. So his sessions are actually fun, and I've always enjoyed coming to see him, and I expect I will be continuing to work with him as long as he's practicing. I also have my son who has a condition called obsessive compulsive disorder. My son worked with Dr. Rodriguez on Kauai for several months, and Dr. Rodriguez probably produced more improvement in my son than any other treatment that my son was doing with regular doctors and psychiatrists. So I think Dr. Rodriguez is truly an amazing man, and I would even call him a genius.
Hi, I'm Dr. Abel Rodriguez. I'm a chiropractor, and I've been practicing since 1974. And during that time, I've practiced and helped many, many people with their back problems and neck problems. But what I also discovered is I discovered actually what creates disease in people. And the way I originally found this out was that I've been gluten intolerant, like many of you are. And when I discovered what creates gluten intolerance and was able to fix it, I then applied that technology to high blood pressure, to diabetes, to cholesterol, to dyslexia, numerous different diseases. And to my astonishment, I was able, through this technique, to not only find what creates disease in people, but what creates disease in you, and most importantly, how to fix it, and fix it on a permanent basis. And that's basically what I do. So although I am a chiropractor, I do things that is beyond regular chiropractic care. I find the cause and I fix the cause. That's how unique this particular mode of treatment is. Finding the cause and fixing the original cause of the problem.
By the way, Dr. Rodriguez, I had a question for you. How could something like this fix diabetes?
You know, that's a really, really good question. When we're talking about diabetes, it's commonly assumed that the pancreas itself has failed, and quite often it does fail. But this particular technique not only identifies the fact that the pancreas has failed, but will identify why the pancreas has failed. In other words, the pancreas could be stressed by, say, the thyroid, and the thyroid could be stressed by possibly a particular emotional stress. So the way that diabetes would be fixed in this particular instance is that the thyroid has to be fixed before the pancreas will fix. But the thyroid isn't fixed by just any method. If it's a particular emotional stress that somebody may have experienced as a child, for example, that emotional stress must be erased so that the thyroid will then function normal, and in turn, the pancreas function normal. So the trick to the whole thing is to find out what created the problem in the first place in its sequential order. If that's not done, the diabetes, the pancreas, will never fix itself. It must be fixed in that manner.